Researchers at UC San Diego Health have received a $5 million grant from the National Institutes of Health to expand their study on Alzheimer's disease. They're focusing specifically on women, and tonight they're looking for more participants.
I found that daunting. I did not expect that.
Julia Abramsky, whose brother Mark is living with Alzheimer's, was surprised to learn this.
2/3 of Alzheimer's cases are women.
Dr. Erin Sunderman, along with fellow UC San Diego researcher Dr. Sarah Banks, are now working to determine why.
Definitely women live longer than do men, but that's not all that's accounting for it.
The study is called Women, Inflammation and Tau Study, or WITS. They're looking to see how lifestyle and biological factors like sleep, physical activity, diet, sex hormones, and inflammation all interrelate, possibly leading to more brain changes in women versus men.
So in this scan, the pink areas are areas where there's some tau in the brain.
Doctors say tau tangles wreak havoc on neurons.
Women have greater tau in their brain. And so what we're doing is trying to find out why.
Now, researchers are expanding their study to include more people, thanks to the $5.2 million grant they received from the National Institutes of Health.
We're definitely asking for more participants. The women in the study are amazing. They come in for several visits and they go through brain scans, cognitive testing, lumbar puncture.
But if the people coming after us can benefit from it, from what's learned from our bodies, bring it on.
Julia's brother was diagnosed in his late 60s.
Watching somebody that you know and love lose themselves, just lose themselves.
She says the journey has been difficult.
It was very hard to watch, to see that happen.
Participant Carol Frank says her mom was diagnosed at 62.
Every time I forget a word, it's like, uh-oh, is it happening to me?
Carol is 75 and stays active to help keep her mind sharp.
I exercise every day. It's just who I am. It makes me feel good. I like the endorphin kick.
Researchers hope they can change the trajectory of the disease.
There is strong evidence linking quality and quantity of sleep to risk of Alzheimer's disease.
By studying more women and determining which factors drive changes in the brain to reduce the risk of Alzheimer's.
So if women are the vast majority, oh dear God, women, come together. Let's share what we're going through to help our daughters and our granddaughters.
The grant expands the study to 110 participants. You must be at least 65 years old, commit to a 24-month period, go through a screening process, be willing to get a spinal tap and some blood work done. It is a blind study, meaning you won't get any information unless researchers make a significant health finding for you to follow up with your primary care physician. If you're interested, visit CBS8.com's help button for more information.
So many of these studies and trials being done in San Diego, and people's involvement so valuable to it. It's a way you can give without giving financially. You can be a part of finding a cure.
Right, and this is pretty non-invasive,
right.
And so, they're asking for more participants.
Anything surprising in what they found at this point?
I talked to the doctors, and my mom had Alzheimer's disease, so I'm curious, what can I do? They actually said 75 to 80% of the women in their study turned up to have sleep apnea. They have them do a sleep apnea test, and these women never had any symptoms that they found concerning, didn't even have sleep apnea on the radar. So that's one of the things that can be treated easily with the doctor's help, but maybe there's not enough oxygen to the brain and just constant lack of oxygen during sleep. Maybe that could have something with the tau.
All these different studies, we're learning more and more about brain health, which Alzheimer's is one name for one disease, but there's so many different types of dementia that all these studies are incredibly helpful.
Yes, and June is Brain Health Awareness Month, so important to get the word out there. And if you think you might be a candidate, go ahead and reach out to them.